Welcome to CityWorks, a co-production of the City University of New York School of Labor and Urban Studies and CUNY TV. I'm Laura Flanders. Each month, CityWorks explores the challenges and lived experiences of working people, on the job, at home, and in our communities. On today's program, two distinct takes on fairness and justice and health in the workplace. We'll explore a worker campaign by home health aides who are organizing and fighting here in New York City to put an end to their intolerable sweatshop-like working conditions. We'll also look at how artificial intelligence is reshaping our jobs and workplaces and our classrooms. But we start with New York City's home health aides, who are demanding that the city put an end to the 24-hour workday. These in-home health workers, mostly immigrants and women of color, have long complained for more than a decade now about their grueling 24-hour shifts that come at a cost physically, emotionally, and economically. They're typically paid for little more than half of their time. The City Council has taken up the issue. There's a bill currently circulating, and Mayor Mamdani, Governor Hochul, labor unions, and patients' rights organizations are all weighing in. Not all of them say the bill, at least in its current configuration, should pass. There is a lot to unpack here, and fortunately, we have got some remarkable guests to help us do just that. JoAnn Lum is an organizer with the National Mobilization Against Sweatshops and the Ain't I a Woman campaign, a coalition that's come together specifically to end this 24-hour workday for home attendants. And we're also joined by Luz Estrella, a home care worker from the Dominican Republic who has worked 24-hour shifts for 12 years. She's been a leader in this fight, including a recent sit-in and hunger strike for justice. And we're joined by Galvan, an organizer with the Ain't I a Woman campaign. Welcome all. It is a great pleasure to have you with us, although I am sorry it's in these circumstances. JoAnn, when you first talked to me about these 24-hour shifts, I was shocked. So to jump quickly to the chase, what are we actually talking about here?
So in New York City, many home attendants are forced to work 24-hour shifts, taking care of people who need care, round-the-clock care, in their homes. These are people who receive Medicaid. So this is public funds. This is the government, the city government, state government, because it's state money, who say that working 24 hours a day for days on end, 4 days, 5 days, 6 days a week is fine. What the reality is that the home care workers are forced to work 24-hour shifts. And when we say forced, it's because it's not like, you're in chains or a gun is pointing at you. But when the agency says to you, okay, I have this shift, it's 24 hours, you take it? If you say no, they'll say, well, then I don't have anything else for you. And so if you have a family to support, you have rent to pay, what are you going to do? What choice do you have? So that's why so many thousands of these home care workers take these jobs.
Let me ask Luz to describe it a little bit, because you've been doing this for a long time, many years. Tell us about how it has been for you, and maybe at the beginning when you thought a 24-hour shift would include some sleep. What's the situation in these households that you're in for those 24 hours? Do you have your own bedroom to sleep in, for example?
Sí, podría explicar cómo es de trabajar turno 24 horas, qué tiene que hacer, y especialmente al principio, cuando empezaste a trabajar, pensaba que, sí, yo voy a poder dormir y todo, y tiene un cuarto, una cama para su...
Cuando voy, me hago mi físico y vuelvo a la agencia. Me dice, ya tiene un caso el domingo. Yo entré domingo a ese caso. 17 de febrero del 2005.
Wow. Okay, so I started my job on a Sunday, February 17th, 2005.
En turno de 24 horas, una sillita de madera, no así, porque aquí esto está en una cama que yo puedo tribarme así, dormir ahí, no. En una sillita de madera, pegada así de la cama de la doña ahí. Y me ponía de ese lado, me ponía de ese lado. ¿Y quién quiere 24 horas? Porque nosotras éramos tontas. No sabíamos de leyes, no sabíamos la consecuencia de nuestra salud.
So when I had this 24-hour shifts, like in this one case, for instance, I had a wooden chair. Not even a cushion like this where I could lean back and everything, no. It was a wooden chair that was put right next to the bed of the patient. And so all I could do was lean from one side to the other if I tried to, get some rest. But who can do that? And who would want to work 24 hours? We didn't know the laws and we didn't know anything at that time.
And you didn't know the medical condition of the patient, the client.
Right, and she also said, and we didn't know what consequences this would have to our health.
And to your health too. So let me come to Vic on this. Because the significance for this is, anybody that has tried to sleep on an airplane, I think, knows perhaps a little bit of what Luz is describing physically, but emotionally, economically. Can you talk about this? And there might be people out there, Vic, who say, well, it's just 3 days and you did sign, et cetera, et cetera. Can you talk about why this Ain't I a Woman campaign is so important to you right now?
It feels important to ask, what kind of society are we building? Because right now, the current system enriches home care agencies and insurance companies, and it's at the expense of workers who are being drained of their health. And that's the brutal logic of capitalism, and it's upheld by specific people, specific policies, and a culture that tells us that we're just lucky to be employed.
Coming back to you, JoAnn, the arguments, well, tell us about the bill. There's a bill right now in City Council. What would it do? And because we are short of time, can you address some of the challenges that have been raised, the criticisms that have been raised? Because they have to do with, no surprise, money. We're told the system will go broke, that Medicaid doesn't have the funding, that the industry would be in trouble. What can you tell us about the bill and how it would address this issue?
There's a bill called the No More 24 bill, and it's Intro 303. What it would do is put a cap on hours per day at 12, and to say that, so basically abolishing 24-hour shifts, saying that 24-hour care should be provided 12-12, and that there should be no surpassing 56 hours in a week. So it's really addressing control of time. So unfortunately, there are opponents to the abolishing of the 24-hour workday who are, and some of them are surprising, like Legal Aid Society, who represent a lot of the wage claims of the workers, and DC 37, who say that, no, we can't do this. We can't get rid of the 24-hour shifts because there's no money. This is a state issue, there's no money, and this is going to send patients into nursing home. And so what they're doing is they're trying to use the issue of money to say that it is impossible. However, this proves to be untrue because of our campaign, our organizing, several agencies have on their own, working with the insurance companies, split the shifts. She's working 12 hours on a 24-hour now, for example. Also, outside New York City, they provide 24-hour care in split shifts of 12-12 and 8-8-8. And those agencies that have split the shifts, they're still running. They're not bankrupt. One time the home care workers met with 1199 SEIU, of which Luz is a member, and she said, if we have to pay you for all the shifts, because they're only paid for 13 hours of 24, the industry would go bankrupt. So this is what we're building this industry on the backs of these women, on the exploitation. And so people said the same thing when we were trying to abolish chattel slavery.
The 8-hour day.
The 8-hour day movement, right? Like how the country's economy is going to go down the drain. So no, we say this is, workers, we have our health, our families, our lives. This is what is important. our society's got to figure out how to support that.
Vic, coming back to you for a second, forgive me for making assumptions, but you seem to be the demographic that has been very supportive of our new mayor, Mayor Mamdani. I don't know whether you campaigned or supported Mamdani's campaign, but Mamdani ran on making New York City a place that we could love again, a place where unions would be strong. He had just addressed the May Day rally in Washington Square Park and talked about the importance of workers. What's your message to Mamdani, and where does our mayor stand on this?
Yeah, I mean, Mamdani had campaigned on ending the 24-hour shift. And my message to Mamdani is to, follow through on his promise to end the 24-hour shift and pass the No More 24 Act. A lot of us supported him in his campaign to, make the city more affordable for us, a place for us, for all of us to live in. I guess my question to him is like, whose side are you on, really? If you really are committed to the workers, you would pass this No More 24 Act.
So much of what you're saying speaks to me of the vagueness around the term choice in the current economy when there is so much need, and the invisibility of the consequences of trying to resolve the societal need for care for our elderly and our needy population, our vulnerable population, on the backs of poor workers. I feel the consequences of this across many, many sectors, and I hope that we can touch on that. But I do have to ask you, Luz, about your kids. If I have my maths right, you've now got a 18 or 19-year-old and a 23 or 24-year-old daughter and son. How are they? And how have they fared in this experience of yours?
Ella quiere preguntar acerca de tus hijos. ¿Cómo están ahora? Y ¿cómo ellos han pasado por tu experiencia trabajando turno 24 horas?
Yo estaba trabajando por 12 años, 24 horas, y hubieron 3 casos en mi familia, en mis hijos 2 casos, que fue cuando mi hija se hizo mujer, que estaba una cesárea. Yo no pude estar en la operación que le hicieron a ella. Y también el otro hijo mío, él se puso grave, muy grave, botando la sangre por aquí, por toda su parte. Y yo cuando me llamaron, estaba trabajando 24 horas, llamé a la agencia. Dije que por favor que me manden a alguien que pudiera ir a reemplazarme. Y me dijeron que no había nadie. Y también ese día yo no pude, ni al otro día, me pasaron hasta que no cumplí mi día de salida, yo no pude ir. Y cuando yo llegué al hospital, al presbiteriano de la 168, mi hijo estaba más blanco que esa cosa de esa televisión ahí, más blanco que eso, blanquito, porque perdió toda la sangre. Entonces eso se llama abuso de 24 horas. Él que ponga conciencia y que no hablen mentira, que no mientan, que saben ellos en su conciencia de su corazón que es una mentira lo que dicen que nosotras dormimos.
My daughter, she was very young when she got pregnant and she needed to have a cesarean. And I couldn't be with her. I was working 24-hour shifts. My son, he was in the hospital. He was bleeding from his ears, from his nose, from other parts of his body, and I couldn't be with him. I asked the agency, I said, I need a replacement on both these occasions and one other. And they said, there's nobody to replace you yet. I had to wait. I just had to keep on working. And so I wasn't there for them. And so this is those who are opposing and acting on this, they need to know this abuse of the 24-hour workday.
We're going to leave it there. Thank you so much, JoAnn, Luz Estrella, Vic Galvan. Thank you for coming in and speaking with us today. We'll be back in a moment with critical perspectives on AI. You're watching CityWorks. Artificial intelligence has upended the way students read, learn, and write. And on college campuses across the nation, instructors and researchers and college officials are struggling to pin down best practices for incorporating AI in this transforming landscape. Many faculty members, particularly in the hard sciences and social sciences, have pointed to the so-called productivity boost that AI can offer and the research potential unlocked by its ability to process and analyze vast amounts of data. But in fields most explicitly associated with the production of critical thought, what is collectively referred to as the humanities, most scholars see AI as a unique threat, one that extends far beyond cheating on homework, casting doubt on the future of higher education itself in a fast-approaching, machine-dominated future. These are some of the topics discussed at a recent panel discussion held at the CUNY School of Labor and Urban Studies. That discussion, called Critical Perspectives on AI, Campus and Beyond, featured Rutgers University Associate Professor Britt and UC San Diego Associate Professor Lilly Irani. It was moderated by CUNY SLU Professor Penny Lewis. Here are some highlights.
So we're all familiar with this story, right? We've been hearing about this story for the last year or so. In 2025, the AI adoption in higher education was noteworthy, not just for its speed of implementation, but for the way it seemed to be reshaping academic activities on campuses that are so often very slow to change. We all remember Cal State, who entered into a partnership with OpenAI, NVIDIA, Google, and many others that cost the university $17 million, even as it was in a budget deficit, even as it was firing and laying off contingent workers and canceling courses for students. And this happened even as the biggest purveyors of AI, like OpenAI, routinely struggled and continue to struggle to articulate or prove how AI is actually good for education and higher education in particular. And even now, as AI companies like OpenAI in particular are flailing, financial forecasters warn of overconfident investments in AI or the AI bubble, yet campus leaders across higher education are pressing forward with these AI partnerships and initiatives. For the most part, we're starting to see some pushback here. 16 states across the country have introduced bills curtailing educational technology applications in education settings. University workers across the country, like you here at CUNY, as well as folks at SUNY, have successfully bargained for contractual protections against AI, and you all have served, I'm speaking from experience and engagement with a lot of other locals. You all have served as an exemplar for other folks who are bargaining around AI in their upcoming and recent contracts. So far, AI being the future of labor largely entails employers using AI as an excuse for massive layoffs, but are left generally scrambling because AI can't do the work. University administrators sign multi-million-dollar contracts with these AI companies, even as students themselves openly mock AI output and its makers as clankers. That's something that the New York Times wrote about recently. I say all of this to say that the infrastructure, financial promises, and public consent for these AI tools, especially in education, is far from inevitable. And I'm meaning to, sort of counter some of these inevitability frames that we've been hearing over the last year, especially with regard to its deployment in higher education.
Surveillance at the UCSD campus, but also across the UCs, is set in the context of, I would say, both the Trump administration's attacks on higher education. Trump has certain Trump and his coalition, they have certain kinds of departments they don't like ethnic studies. They have certain kinds of research that they don't like climate change research or research on gender. And specifically at UCSD, also in the era after the encampment protests over Palestine, the school has hired people called community specialists who will observe campus activities, expressive activities, and write up police reports on student activists. And so we're in this context where both the university is surveilling students and faculty and staff, and also the Trump administration has been throwing so many tricks with cutting off federal grants, doing civil rights investigations that demand personally identify information about medical school applicants, about Jewish faculty on campus, there's been all kinds of different interactions we've been having with the federal government. So in that context, a lot of people are feeling both surveilled and vulnerable to what surveillance data could, what penalties it could bring for them. Now, one of the big issues on our campus over the last year has been over cybersecurity software called Trellix that basically the University of California Office of the President mandated that all university computers have this certain software installed on it. And the software, it's supposed to reduce the risk of our computers and laptops being hacked, because the UC, has hospitals, it has Department of Defense data for if some faculty do that kind of research. There is high-risk data. The software is supposed to allow IT workers to quickly intervene and interrupt attacks. But the software is really intrusive. It basically gives IT workers on campus access to everything on your computer, to your keystrokes, to your software, to your photos. How many of you have a CUNY-issued computer? Okay, and how many of you ever have to do personal stuff, like look stuff up for your bank accounts or like your medical, your doctor's appointments, because we're working all the time. So it's all, yeah. So this Trellix software, faculty have had a bunch of different issues with it. There's a general feeling of ick. There's like a specific fear of what happens if the federal government decides to subpoena an ethnic studies professor's computer or a climate scientist's computer. Is the University of California or UCSD going to get all its lawyers together and fight that subpoena to protect this person's computer when it has a whole bunch of federal grants on the line? I think people predict probably not. This cybersecurity question is actually an academic freedom issue and a shared governance issue. Because one of the problems we were running into on our campuses was that IT workers were like, why are you faculty so exercised about this cybersecurity software? One, everyone who works in a corporate workplace, like a lot of people actually have this kind of software on their work-issued computers already. And so we had to kind of explain to them why education and research work is not just the same as any other kind of corporate job, especially in this political environment. Technology choices do affect education, they do affect research, and so they need to be something that faculty actually have a voice over.
We've needed better protections around technology in higher education since 2000, probably earlier than that, I'm sure, but that's sort of where I start tracking it. we've needed this for nearly 30 years now, and now it's, you know, with the advent of AI and its deployment across higher education, it's not something that we can ignore anymore. And especially as these companies are targeting higher education because of many of the reasons that we've talked about before. They're being defunded, they're in the sort of crosshairs of the federal administration. Public support for higher education is, you know, it is what it is. And then we've seen these massive investments really skyrocket into AI. We've seen these deployment strategies across, you know, many different sectors. We have seen deregulation facilitating all of that from the Trump administration. And that has, I think, certainly led to this feeling where we feel like it's being pushed down our throats. That in addition to, like, it's in the top of all of your search results.
Well, it's
you
like
can't turn off
literally
Copilot.
been designed to go shove it down your throat. Like,
Yeah,
that's a
because
design
nobody wants to
choice
use
on
it.
purpose.
Because nobody really likes it and wouldn't use it if they weren't forced to. You know, you leave your cursor dormant for 1 second, it's like the little AI icon pops in.
Critical Perspectives on AI, Campus and Beyond, a recent panel discussion held at the CUNY School of Labor and Urban Studies. And that's it for CityWorks this time. If you have comments or questions, write to us at cityworks@slu.cuny.edu. And if you like what you just saw, consider making a donation to CUNY TV or the School of Labor and Urban Studies Foundation at the links below. For CityWorks, I'm Laura Flanders. Thanks for watching.